I spoke about the future of photoprotection. Several aspects that I cover. One is that the effect of visible light and ultraviolet A1 light on the skin and how to protect against it. This is a relatively new area in photobiology and photoprotection, mainly because visible light is not protected by the typical ultraviolet light filters that we have in sunscreen in the US. So there are several ways to take care of it. One is by using tinted sunscreen. It does work against visible light in terms of photoprotection, but the limiting factor for many of the tinted sunscreen is that it causes discoloration on the skin, especially for very light or very dark skin individual. Antioxidant containing sunscreen is another way to help to protect the effect of visible light and UVA1 in decreasing the tanning response that can occur with those light sources. The third one is an oral photoprotection of using polypodium leucotomus. This is the one that has been studied the most. So that would be something that can be considered also for patients in the United States. In Europe, there are filters that have been developed that protect against ultraviolet light as well as against visible light, but those filters are not yet available in the United States. The concept of personalized photoprotection is that photoprotection advice should be given based on multiple factors. Patient skin type. Patient with light skin requires higher SPF because they tend to develop sunburn. Patient with darker skin, the SPF could be lower. SPF 30 should be sufficient for them. Patients with darker skin, on the other hand, because they develop hyperpigmentation more frequently, they should have a good UVA protection in their sunscreen, as well as a good visible light protection in their sunscreen. Less so important for lighter skin individual. Where people live, where people work, outdoor versus indoor, obviously those are other factors that needs to be considered. New areas is the effect of air pollution on photoaging and on aging in general. A lot of research still needs to be done on that. There are indications at this moment that because pollutants would result in oxidative stress on the skin, because of that it can result in aging and photoaging changes. But again, more studies needs to be done. Skin microbiome is another area that we are beginning to look at as a specialty in terms of the effect of skin microbiome, the interaction with sunscreen, and how it would help to work synergistically to protect the skin from the effect of sunlight.